One of the things that drew me here was, in particular, was the training program, and I felt like it was a piece of the training program that just showed that they cared a lot about the clinical training of residents in general. Like there are other programs that focused more on on basically kind of on-the-job training, and I felt like here they really wanted to make sure that you had the skills before you got to working, and that's what this skills lab represented to me. I've noted that in the clinical situation there's a lot of things going on. So we have social interaction with the patient, we have the patient's family. There's a lot of stimuli coming at you, and especially when you're new at it, it's easy to get distracted. There's other things, there's legal consequences, there's the interaction that you're going to have with your attending, and there's a lot else going on besides just clinical deduction and assessment and so on. And so in the clinical skills lab, it focuses more on the clinical facts that are important, the clinical scenario, and helps improve your assessment and helps focus your thoughts on the things that are important for making key clinical decisions in a timely manner.
My name's Jody. I'm a student nurse.
Oh, okay.
Are you having pain?
There are several things that have surprised me about the skills lab. First is the amount of materials and models and things that we have to work with. The mannequins, for example, and just how lifelike they are. It surprises me that I can put my stethoscope on and listen to their heartbeat. I can listen to the breath sounds. We can test things. You feel the pulses all over in all the places that I would feel for a pulse in clinical scenarios. So that to me, the lifelikeness of our models, and then the sheer number of them for all the different procedures and scenarios, it surprises me a bit, as I would have thought it was a little more rudimentary than the materials that we have. Prior to coming here as a medical student for rotation, I had never seen a medical skills lab. In our medical school, we cut on hot dogs and chicken legs, but we didn't have models that really duplicated as much as we have here. And so I guess I really had no perception of what a medical skills lab was until I was a medical student and came here for the first time. So I didn't even know that they existed and that they were this helpful. So the experience of trying it for the first time and just how well it helps you to focus in on the things that are important is kind of surprising to me. We've done clinical scenarios with the mannequins involving many different clinical scenarios, but for example, in a burn patient, and making the appropriate decisions and checking the correct things, having an appropriate physical exam. Being able to do that on the fly when you haven't seen a lot of burn patients is difficult. So as an intern, having done that here first and kind of organized in my mind how I'm approaching this patient, and then later seeing it upstairs in the emergency department, it's very helpful in that I already had something organized, almost as if I had seen a patient with the same sort of presentation before. And so it gave me a framework to build upon in actual patient practice. I could give you another example if you like. We practice a lot of suturing down here as well. And even though I was very interested in surgical techniques and have had many opportunities to practice them, there are still some things like a corner stitch on a laceration, which in this skills lab was the very first time that I learned how to do that. And then later I did have a patient with a laceration, a Y-shaped laceration, which requires that specific corner stitch. And I knew how to do it. I knew what depth to put it at, and I knew how much tissue to grab, and was able to do that skill that otherwise I probably would have had to have someone else come and do it for me. So as far as the caliber of our training here, our attendings come to the simulation lab with us. They've had first-hand experience with things like putting in a chest tube into a patient, and to kind of walk through the steps with them here where there's not a patient dying or in respiratory distress, very helpful, because as I've experienced it in the real situations, the time that it has to be performed in is very short. And so I guess to have my attending teaching me the same skills that they would be teaching me upstairs here, again, it can't be duplicated up there. And so the caliber of training from my attendings is excellent, and that was another one of my draws here. Doctors like Dr. Cooney, Dr. Casey, I mean, these guys, they know what they're doing. They're experienced and have their own particular areas of expertise inside of emergency medicine. And so here they're able to transfer that to me in a low-stress situation. We're a level 1 trauma center. We're seeing those difficult cases referred here. As far as the level of pathology, we have just as much pathology, and even better than a lot of urban centers that are very specialized, because you'll have, say, a children's hospital. So if that's next to the trauma center, then those pediatric patients are going to the children's hospital. They're not going to that level 1 trauma center in the urban setting. And so here, we're in a community, not a big city. We're still getting all the same pathology. They're funneling through here from multiple counties, and I mean, we see it all. I've seen at least a half dozen gunshot patients in the last 8-9 months that I was here, and I've seen stabbings. I've seen people with all kinds of those pathologies that you wouldn't associate with a place like Johnstown, but you still see it here. And so as far as the cases that you'll see, it's here. It's here. So that's not a concern at all. As far as Johnstown, I think it's a wonderful place. I've heard other applicants be concerned that it's a smaller town and that there wasn't enough going on here. And I tell them it's here. It really is. I mean, there are horseback riding clubs, there's dart leagues, there's bowling leagues, there's movies, there's mountain biking, there's snowboarding, ski resorts. There's things here. It just depends. What are you interested in? And that's what I tell them. And when they give me an idea of what their hobby is, there's something here. And if someone's looking to live in a big city and ride a taxi to work, well, this isn't the place. But if you're looking for a good place to work with excellent doctors and again, excellent cases and more to learn than you have time to learn, this is a great place. And I find, again, with this residency, more than any other residency that I interviewed at, the attendings were top-notch, and they really cared about training and being good academic doctors, but also in passing that on. Similar to what I said earlier about not just wanting warm bodies to fill a residency, that they really are dedicated to training and training us very well, and that's what I find here. It's excellent. I mean, as manifest by all the awards that the hospital has won, and as you interact with the attending physicians, I mean, these guys are very intelligent. They know what they're doing, and I have so much to learn from them that I can't imagine that even in the 4 years, short amount of time of my residency, that I'll even get close to the level of knowledge that they have. I will never learn everything that I can from this place.